Yes, I'm going to talk about health, urban form and modelling. Now, in the beginning, the confession is I'm actually an architect. I've got into modelling urban systems about 10 years ago, and through the work on modelling systems, that has led on to health. I don't have the background in public health, so some of the issues that I might talk about might be incredibly obvious to people from a health background. But I think there's been a change in the issues that urban designers are talking about in the last 5 to 10 years. And these are questions that are going to be raised more and more as we go ahead. And I'm going to show these issues through, eventually it comes to show an example of a project, which is about a particular software tool that we've been developing and that we're going to explain a bit more as we go on. So the starting point from a very high level is actually to say, what do we mean by health? And there's a whole set of things that we can break this down to. There's communicable versus non-communicable. There's things like obesity, which you see in the news almost every other day at the moment, and what we should do about it, cardiovascular, respiratory, and mental health. Now, to make these relevant to people who are in the room, I think there's a question which is, what we are really involved in is controlling and shaping urban form. So there's a really fundamental question, which is, how does urban form impact on health and on some of these factors? Now, if we take obesity as an example of this, this is a systems map that was produced by the Government Office for Science Foresight Group almost 10 years ago. Now, they've got a whole set of factors which are influencing obesity. And you can see there's kind of psychological, there's economic, there's social. The red circle on the right is where it talks about the walkability of the environment. So of all of these factors, walkability at that point was something that people thought was having a relatively small impact on obesity. Now, if you look at actually what makes walkability, things like the network of streets and spaces, infrastructure, density, the land use mix, those are really difficult things to change in a city. They take a long time, they're slow, they're expensive, it involves things like changing land ownership. These are really, really difficult things to change. It's also the part that this group of people have the ability to influence. Now, since then, there's more research, and some of the things that have come out of it is this idea of the obesogenic environment. Now, typically, this is described as something which is low-density sprawl on the edge of a city. This is an American example. Typically, it's kind of cul-de-sac development, single use, no public transport, not very close to anything. Now, there's the kind of principle that makes things very difficult. It's very difficult to walk anywhere. Now, the counter to that is that if you want to make somewhere which is more healthy, then you need something which is higher density, better connected grids, better access to public transport, and mixed uses. Now, on one hand, that makes lots of sense, but there are a number of complications to this. So this is Barcelona. The example that I'm going to talk about is not actually Barcelona. I just wanted to show this kind of similar characteristic of urban form everywhere. Now, a lot of the research on health has been done in Europe, North America, and Australia. It's quite developed countries, and these relationships you find between what's seen as being healthy, they're not found consistently in all of these countries. They're not found consistently within, there's differences between cities in the same country and between different parts of the same city. Now, there's one example that comes up fairly often, which is a city called Bottrop in Germany. I've probably mispronounced that terribly. But there are two parts of the city which, if you analyse them in terms of urban form, they're both seen as being fairly healthy. They're mixed use, well-connected, close to the centre, public transport, all of those things. But they have completely different levels of obesity. So one has a very, very unhealthy, highly obese population. One has a fairly healthy population. So that's obesity. If you step back from obesity, there's the thinking that higher density is better for obesity. What might be good for one condition might exacerbate another. Now, if you look at the research on mental health, high density, which is seen as being good for obesity, is actually worse for mental health. So if you make cities, if you start to concentrate on cities and making them good for obesity, then maybe you're compromising on another area and making it worse for a different condition. And then, if we step back another step, it's the question about, if you look in the less developed parts of the world, you then get to the question about the kind of communicable versus non-communicable illness. And if you live in, this is a slum in Jeddah in Saudi Arabia, these are actually the most walkable parts of the city. They're mixed use, they're high density. It's not a great living environment. It doesn't have access to fresh water. So you might not be obese, but you might pick up something else, which means you never get to be obese in the first place. So there's a whole pyramid of things that have to be in place. I know this is really, really negative at the moment, so I'm sorry about that. Now, so there's a whole set of complex interrelationships, and it's very difficult to really explain causal relationships between urban form and what the health outcomes are. Now, I think there's a few reasons that this is the case, and one of the reasons is partly the way that studies are communicated, and a lot of studies are looking for a particular relationship. They might not find that exact relationship, but it doesn't mean that it's not true, or it's not part true. It doesn't mean the opposite is the case. So it might look for a study that densities in a certain range are good for obesity. The findings might not show that it's that exact range, but it doesn't mean that low density is good for obesity either. So there's a question about how it's reported. An example of that was that there was something from the States which found that for increases in density, they were able to, I don't remember the percentage increase, they were able to map it to a reduction in obesity level for every increase in density. Now, if you looked at the levels of density, that was going from 8 dwellings an acre to 20 dwellings an acre, which is very low density in comparison to the cities that we're looking at in the UK. So part of the problem is it's very difficult to get consistent measures of urban form and of cities. Cities are big, and they're complex combinations of lots of systems that interact together all the time. And a lot of the tools that we use to talk about cities are fairly blunt, or the descriptions are fairly blunt. So you can talk about density, but we know from the Urban Task Force images, these 3 examples are the same density. They're all arranged in slightly different ways. So on one hand, you can say it's the same density, they must all be the same. But then you're ignoring the component of spatial layout, the fact that that has a big impact on walkability. It will completely affect the character of the place, what it's like to live there, and how some of the kind of everyday things. So we need to start to think about spatial layout and the structure of space in a different way. Now, a lot of studies start to use a measure which is talks about junction count, and it starts to look at junction count per hectare. And the idea is that if you've got lots of junctions in a hectare, it means that it's probably a connected grid. So the more junctions you've got, the more connected it is. And I'm going to talk about this in a little bit more detail and kind of critique some of these measures. Now, I've got 5 study areas from London. These were picked completely at random. They're not projects we're working on. They haven't got anything to do with anybody in the room, or they shouldn't have. They were just randomly selected. Now, if we first of all isolate them, we can look at the densities. We've got, you can see Surrey Quays, bottom left, we've got 40 dwellings a hectare. Stratford, the part of the new development on the Olympic site, is 110. All of these are on the high end of the scale compared to the American examples of density that we found earlier. Now, if we start to look at this case of junction count, if you start to look at the number of junctions within each of these developments, you start to see something really interesting. So Surrey Quays has a huge number of junctions. It should be the most connected, the easiest one to walk around, and the most healthy. If you actually look at it, it's made up of a lot of cul-de-sacs. It's only got 1 or 2 connections into that subdivision. And internally, it's a lot of spaces which are probably not working together and are actually distributing people over a wider area. So in some ways, this is the problem with a lot of measures which take a boundary, a discrete area, draw a boundary around it, and look just within that boundary. So I think, one of the things that we need to start to do is to look outside those boundaries and start to see how areas connect together with bigger bits of the city or within the wider context. Now we have, at the moment, what we've got on the screen is a spatial model. Now all this is just, it's all of the open streets and spaces which are found in London, and we've again zoomed in on each of these. Now, to begin with, this is still working within the kind of discrete boundary. All that I've done is take the length of the street network and divided that by the number of households in that area. So if you again compare this to what we just saw on Surrey Quays, where the junction count for Surrey Quays would seem to show that it was a better layout because it had more junctions, it should be more connected. What you can see is actually the distance between households, or the average distance between households, becomes further away, which you would think would make it less walkable. Stratford, again, these 2 reverse positions completely. Stratford is high density, very, very close together. So people in Stratford are closer together, which you would think would be more walkable. There's a whole question which we haven't got onto, which is about how walkable a neighbourhood is. And there are lots and lots of issues around the way that we understand walkability in neighbourhoods. Now, again, these are fairly simple measures, just looking at the street network, counting how many streets are within a defined distance. And again, red lines are showing that you've got more streets within 400 metres of every street. So you can start to see where you get more dense, more intense networks. But this is also starting to talk about the structure and how it crosses over the boundaries of the site as well. Now, there's something which is a really kind of key part of this, which is that as urban designers, we tend to think of neighbourhoods as being about 800 metres from the house. Now, there's a specific piece of research that somebody did, which was to look at where people carry out their exercise, and people had heart rate monitors and GPS, and the two bits of information were combined. What they found from the research was that actually the places where people undertake the exercise is often, it's much more than 1,200 metres from their home. So that either means that the definition that we have of a neighbourhood size as urban designers is too small, or it means that people don't exercise in their neighbourhood. It means they're driving to other places, which means thinking about things in a slightly different way. Now that starts to lead on to something interesting as well, because when people talk about obesity, there's a lot of focus on the neighbourhood, but where you live is only one part of your day-to-day life. It's not just your neighbourhood where you live, it's where you go to work, and it's where your friends are, and all of these other things. So we need to start to be able to use these measures to look at how one particular part of the city or one area feeds in to the whole of the wider city network. There's also then the question about how strong the connections are. You might be far from the centre, but you might be able to get to it very easily. You might be close to the centre, but you might have a very difficult route to follow. So there's a whole question about, there's lots and lots of areas on the spatial network where it becomes very important to look at across a lot of scales at the same time, and to look at lots and lots of different components. So I think one of the problems that we can see from this is that we've just looked at 5 different measures, and they all show slightly different things. Now, if it's so difficult to find a consistent way of describing these urban areas, it's going to be very difficult to find consistent principles or consistent factors that are contributing to obesity and to health in general. So that's not very helpful. So we have this question, what do we do? Now, this is something that in the last few years, this has had lots and lots of press coverage, and it's very difficult. Cities are complex systems, and they've got people in them, which makes it even more complex. There's a problem of consistently describing them, and those two things make it very difficult to talk about causal relationships, which mean that it's very difficult to talk about how you might intervene in somewhere, how you might begin to improve it or change things. Now, because something's complex, it doesn't mean that you shouldn't try to address it, and especially if the long-term risk is very high, which in terms of childhood obesity is a really high risk. And there's a headline on here about childhood obesity being a huge, here it is, an exploding nightmare. So there's then linking it back to the question of urban form. There might be some inconsistencies about finding out exactly what urban form is very healthy. But there are some things about urban form which make behaviour completely impossible. If we design everywhere, like the American suburb that we had to begin with, is completely impossible to walk everywhere. So there are some principles that we can start to follow and that we should start to use to think about in a different way and to make things connected networks of streets, mixed uses, higher densities, good connections to public transport. There are things which are more difficult to design, things which are a sense of safety or sense of community. And these things become really important in terms of how much people are prepared to exercise and how much people tend to walk in the areas that they live. Now, we need to do something, and we need to look at urban form because it's difficult to change and it takes a long time and it makes some behaviour impossible. Now, those principles that we were talking about, the things about more connected grids, higher densities, mixed uses, our experience through kind of real-world practice and through research is that those conditions are not just associated with more healthy places to live, but they're also associated with places which are economically more successful, they're more vibrant, they're the places that people enjoy living in. So although there's some kind of finessing or there's a little bit of detail which isn't quite clear about exactly what level of density you should go for, exactly how you explain it, those principles should be the things which are starting to drive new development. Okay. Now, I think the Bottrop example showed that we can't just roll out these principles everywhere. We need to start to look at places in a more, almost in a local way, but within a wider framework that allows you to compare, say, Bottrop to London, to Barcelona. Now, we might find if we do that, if we measure things consistently, we might find that actually a change in urban form isn't going to do it. It might be that it already has the urban characteristics it needs to. It might be something along the lines of an education program to do with healthy eating, or it might be something about subsidizing public transport. It might be a non-physical intervention in that area that's required to make somewhere more healthy. Now, to be able to get to that kind of decision, it means that we need more sophisticated ways to understand cities and to compare it to actual outcomes and to say not just how do these systems combine, but actually what does it mean for the people who live there. And that is where I think data and analysis and modelling and the insight that you get from that begins to come in. So if we want to use modelling to do this, or data and modelling, there's a whole set of questions about what do we need to think about. There's the question about where do people live? What's the density? What's the mix of uses? Is it close to parks? Is it close to schools? Does it feel safe? Is there a sense of community? And it's also that we need to be able to look at this across lots of scales. It might not be just at 800 metres. It might be 1,200 metres, 400. It needs to be something which is flexible and multi-scale. There's a question about where people work and also what those areas are like. If you work in a city centre and you can go and walk around and get a sandwich for lunch, that's something which is very different to working on, say, a business park where a sandwich van comes around and comes into everybody's office and you don't leave the office all day. So there's a whole question, not just about where you live, but where you work and what the urban environment is like where you work. There's then the connection between work and home. If it's somewhere that you can use public transport or active transport. There's not just a question about where I live and where I work, but then everybody else. And you begin to put together this whole overlapping network of a city. And it's a much more complex picture than this. So we have this, we can start to talk about the infrastructure and the hard systems and how they interact. But the thing that becomes really important is to be able to link that to what it actually means for people and to be able to feed it into data on health, things like deprivation, income, all of those kind of socio-economic measures as well. Now we've started to, through practice, in the last, this is probably about, this image is almost 3 years old, we started to make what we call integrated urban models. And these are really combining hard infrastructure systems. So it's the street network, public transport, we've got employment density, we've got population density. And the image in the middle is something which is saying, we're saying, how do these areas combine? Or how do these systems combine? And what does it mean for people? So what we've got in the middle is an analysis saying, how many centres do I have access to within 15 minutes journey by any mode? So in this case, the centres are where there is employment, there's education, there's health facilities, there's all of those kind of supporting services you need to have access to. Now the red areas, you've got access to, I think it's something like 12 to 15 centres within 15 minutes. The blue areas, you've only got access to 1 or 2. Now we can show this on a map, or we can show it more statistically in terms of a graph. Now the way that we've been using this so far is really through scenario testing, and it's to look at the impact of planning. And in this case, it's really about comparing planning scenarios. We're not at the moment, or in this example, we're not connecting that to what it means for people. So we don't know if you've got access, say you live in the red part of the city in the middle, are you more healthy? Have you got a better job? Are you more educated? All of those things. In some ways, it's really testing how well the principles of a plan have been implemented in a different option. That's where we had got to a couple of years ago. Now, where that's been developing is in the last year, we've been working with the Future Cities Catapult on a project called Tombolo. Now, this is an Innovate UK funded project. We're 1 year into a 3-year project. And the aim of Tombolo is to take these tools and techniques, to combine it with open data sets, to make an open source tool to make models of cities which can support decision making and allow data to be combined in a way that it isn't currently done. Now we've been developing the tool with 3 partner cities, and we've been developing 3 use cases with each of those cities. Now, what we've got in the background is the case study of Greenwich. And at the moment, this is just being used to check that the model is working in the right way. So what we're doing is taking data on where people live, where local centres are, transport networks, and we have looked at how many town centres are within 5 minutes journey by car to everywhere in the borough. So the dark blue have got access to more centres. The grey have got access to no centres. Now you can see if you travel by car, it's a huge amount. Almost 70% of the people have got access to 3 to 5 centres within 5 minutes. Now there's assumptions in the model about the speed you're moving and all of those things, and it needs fine-tuning, but there's something which is there. There's then a question that, okay, if you haven't got access to a car, how does that change for public transport? Now you can see that that number who've got access to 3 or more centres goes from 70% down to 5%, which is a huge change. And then again, if you take out public transport and you say, what if you're walking? Nobody's got access to more than 2 centres. So the picture of how the different layers of infrastructure combine to affect access to key services is the area that we have been testing this at the moment. Now, this is kind of where we get to the so what question of this. And in some ways, it's kind of frustrating. We've got to the bit where it's really interesting, and we're now just getting into the kind of meat of the question. Now, what we've got here is something, the background, what I've added is the index of multiple deprivation. So this is where we're starting to say, what does this actually mean for people? You might not have access to many centres, but does it affect some of these other indicators? And this is what we're really getting into at the moment. And this is where we need to really get into the work. But you can see that there are areas where you've got the worst access to centres in the dark grey, which coincide with the higher levels of deprivation. Having said that, there are also areas where you don't have high levels of deprivation, but you also have bad access to centres. Now, at the moment, that doesn't give us any answers to why it's like that, but it gives us a starting point to look at these areas and look at them in a different way and say, what's happening here compared to here, and what are the things that we could do to change that if we need to. Now, this is only looking at index of multiple deprivation. This is Greenwich. We're looking at obesity. We're looking at in Milton Keynes. And we're also looking at social isolation in Leeds. And the plan is that over the next year, we're going to develop these in more detail. We're also going to apply each of these 3 things to each of those cities. So we should, in a year's time, be able to have a better understanding of obesity in Greenwich and in Leeds, as well as loneliness in Greenwich, and to spread it across the cities in that way. So while we can't answer the questions now as to why these things are the way they are, or whether there is these relationships, at least what we have is a framework or a tool which provides you a framework to look at them in more detail and to look at them consistently across different places and to compare them. So then, what does this mean for cities and health? So I think there's, in some ways, we have technology and data which gives us an opportunity to look at things in a way that we haven't been doing so far. And that's trying to understand complex systems better, looking across many scales at the same time, and looking at a number of issues at the same time. But the technology and the data side of it might be the easy part. I think that probably the challenge is about how this feeds through into the culture of designing and planning and how we operate cities, how we need to pick up on the Patrick Geddes example earlier, how we need to start to become more interdisciplinary, thinking more about kind of systems, how the systems affect each other, and working across the silos and across the sectors that seem to have emerged and which are very difficult to cross within the areas of city planning. And finally, these tools and these approaches need to become a standard within the industry, rather than something which is picked up by the professionals who are at the cutting edge, which is probably the group that we've got in the room now. But it needs to be something which is widely adopted by everybody. And this is where things like the statutory requirements and things like the health impact assessment can become really useful in trying to push these things forward. And that's where I'm going to leave it.